I'm Dr. Beth Colby, psychiatrist in London, and I'm speaking to you on the YouTube channel Talk Mental Health. I have two interesting articles for you today. The first article is about people suspending rational thoughts during a time of storms in their lives. And the second is about a gentleman who spent time in isolation 20 years ago following discharge from a psychiatric hospital and now spending time in isolation with his mother due to coronavirus. The first article was in the comments section, written by Matthew Syed, and is entitled, "We crave order in the heart of the storm. No wonder tall tales and populists are seductive." At the beginning of the article, Matthew Syed states that he received two emails recently. The first was that it was the Chinese who developed the coronavirus to cause a world recession, and the second one was that it was Bill Gates trying to control the world population. He said that in a time of uncertainty, people try to compensate by making order in their lives, and that psychologists call this compensatory control. He said that scientists tried to quash the conspiracy theories by informing people that the virus came from wildlife, not from human intervention. Concerning compensatory control, Matthew said that conspiracy theories and superstitions meet the need for this. He said that it's easier to believe that we are threatened by scientists rather than a virus. In ancient times, the deeper the fear of crop failure, the more that the people did different rituals. An experiment on people who had time of massive uncertainty in their lives showed that they were more likely to interpret random events as connected and more likely to see patterns in meaningless static. An atheist may say a prayer during a time of turbulence on the plane, and this is to make himself feel more in control. Another phenomenon is that people who are not scientists give definitive views on scientific issues, and this also may be a manifestation of compensatory control. The rest of the article is about compensatory control when it comes to politicians and politics. So on to the second article, which was in the news review section and written by the writer Peter Geoghegan. I'm not sure if that's the correct pronunciation. He compares and contrasts two very different times where he was in self-isolation with his mother. The first was when he was 19 in the late 90s. He was at university, and during this time he dropped out, and this was around the time that his parents were separated, and he went on to develop a psychiatric disorder, leading him to have a 6-week hospital admission. This was following a period of time of having no sleep, and as he said, being increasingly frantic. He was later diagnosed with bipolar disorder. He said that thankfully he has never been readmitted to hospital, and for the past few years he's been able to be off all psychiatric medication. As an aside, do not stop medication without permission from a doctor, even if you are well. Peter Geoghegan gave an account of his recovery after his time in hospital. He went to live with his mother in a rural part of Ireland and said he spent his time watching television, reading and eating sweets to try and get rid of the horrible metallic taste of lithium in his mouth. He said that gradually him and his mother became more comfortable with each other, spending more time together, and he began to open up about his struggles. He avoided going out as he was not allowed to drink alcohol, and the only person he saw during this time was his mother. Gradually he became his usual self, got his energy back, his enthusiasm for life, and reconnected with his friends. He was then ready to face the world again and to restart university. Now it's 20 years later and he's in his mother's home, and it's his turn to help her. He said, and I quote, "We are easier around each other than when I was a teenager adrift in his own head." Peter said that memories of parts of his quarantine have come back. the empty days, how the hours dragged on while the weeks flew by. And at times he worries about how he would cope with self-isolation, but says that thankfully these are short-lived. He gave an account of his and his mother's own little companionable routines, him working during the day and then them eating together in the evening and anxiously watching the early evening news on the spread of the coronavirus. Peter reported that he was able to start university partly due to disability allowance and him being able to start with no fees. But the main thing was the love and shelter he got from his mother, and said that now he can be there for her. Peter ended his piece by saying, "The coming weeks and months will try us all in different ways. It will bring pain and suffering. Hopefully we will find creative ways to be there for each other." Thank you for listening. Good night.